you for coming out to our kickoff of our statewide Protect Our Medicaid tour, where we will be sounding the alarm on the devastating impacts of Medicaid cuts to our families and neighbors across Virginia. My name is Lenora Thomas, and I am the president of SEIU Virginia 512, a union representing thousands of public sector workers and home care providers across our state. Our union stands firm in the belief that all working families deserve dignity, respect, fair wages, benefits, and a voice in the workplace. SEIU Virginia 512 members advocate for good union jobs and justice for everyone in our community, and we continue to grow stronger every day. I'm proud to be here today alongside many of our community members and leaders fighting to protect Medicaid. Do we want to protect Medicaid?
Yes.
All right. We are at a critical moment in the fight to protect our health care. The cuts that Republicans in the House of Representatives approved by a single vote will harm Virginia families, burden our state budget, eliminate jobs, care jobs, y'all, and create unnecessary barriers to healthcare access, especially to home care. As the president of SEIU Virginia 512, we proudly represent home care providers across the Commonwealth. But this isn't personal just to us. It's personal for everyone who relies on care. Whether it's now or in the future, we will all need care someday. That's one of our members' favorite things to say to legislators. You might be fine today. You might be high-stepping it today. But one day, all of us will need care. These Medicaid cuts would devastate our economy and access to health care in every corner of our state. It's no secret, in order to win, we need leaders who are ready to fight with us. That's part of why I am thrilled to be joined by several elected leaders, including Congressman Beyer, who has been fighting to protect our health care from the looming federal Medicaid cuts. Before the congressman cuts us off, a bit of housekeeping. Kicks us off, not cuts us off. Kicks us off. You'll be hearing today from several panelists who will share how Medicaid cuts impact them, how they are fighting to protect Medicaid on the federal and state level, and how we can get involved before they answer some questions. Tossing it to you, Congressman Beyer.
Thank you very much. I'm always happy to cut you off. Thank all of you for being here today. I'm really, really grateful that you showed up on this sunny Monday afternoon, and just want to emphasize how important it is that you're here. That here in Alexandria and in every jurisdiction across the country, we are fighting hard to make sure these Medicaid cuts don't go through. You know, they just passed the bill, Donald Trump's big, beautiful bill, which is not big, it's not beautiful, but it's the biggest cut to Medicaid in the history of the Medicaid program. And they started off by saying, oh look, we're not going to cut Medicaid at all. The budget resolution they passed called for $890 billion of Medicaid cuts. And that's what they built into this big, beautiful bill, $890 billion. Now they say, of course, it's just waste, fraud, and abuse. It's not going to affect the real people. It's only going to affect fraudsters and immigrants and young men playing video games on their mother's couch. But actually, it's going to be women and children, overwhelmingly. When I look at my numbers here, the initial estimate on Virginia is we lose 250,000 Virginians with these Medicaid cuts. There are not 250,000 fraudsters and immigrants. And people keep coming to me and saying, why should illegal immigrants get Medicaid? Well, they don't. That's already illegal. They don't get Medicaid. Often they get health care because when they show up at the hospital, we take care of them. But it's not paid for by the American citizens. It's not paid for by Medicaid. And the Center for Budget Policy Priorities puts the Virginia number closer to 400,000. You know, Joni Ernst, I'm sure you watched her the other day, she said, we're all going to die anyway. Well, yeah, but I want to die like when I'm 100, not when I'm 57 or 42. We want to, you know, the whole life, liberty, and the pursuit of happiness is to have good health for as long as we possibly can live. You know, yes, we all love Jesus, we're all going to die, but our job is to do the other part Jesus said, which is to take care of everybody here on earth and to reach out with compassion, with empathy, and invest in each other. You know, it's not just Medicaid. They're also crushing all the progress we've made on the environment. These tariffs I read today, the tariff rate now is 15%. It's the highest it's been since 1903. Even Adam Ebbin wasn't alive then. It was a long, long, long time ago. So everybody's prices are going up. When he just doubled the tariffs on steel to 50% more, which means that if you want to buy a new house, forget about it. Because they're not going to be able to buy any house that they can afford to build, et cetera, et cetera. I wish this were nonpartisan. I'm very discouraged that our current governor in Virginia, our current lieutenant governor in Virginia, both come out strongly for this package. Governor Youngkin actually led a letter with like 18 other Republican governors endorsing the entire package, including these cuts to Virginians. I get confused because I don't know the governor very well, but I can't imagine that he embraces the thought of 400,000 Virginians, most of whom may have voted for him, losing their health care because of Medicaid. This, and by the way, they did give me the opportunity to have my first overnighters in 52 years. I got to stay up all night in the Ways and Means hearing where we argued. We introduced something like 47 different amendments to make this bill better and got not a single Republican vote on a single amendment. And a couple of nights later, I got to speak at 4 a.m. in the morning on the House floor. Well, we lost that vote 215 to 214. There are many, many reasons to be very sad about the loss of our beloved Jerry Connolly. But that's one very great consequence of it. You know, Jerry hadn't gotten sick. We lost 2 others earlier in the year too. I mean, the votes are almost there. So everything we do to fight back just a little bit, I guess, is closer to taking back our country, stop this authoritarian, unitary executive power, and most importantly, preserving our health care. So thank you for allowing me to be part of this with all my wonderful friends, and let me uncut you all.
Thank you so much, Congressman. Next up, we will have Katie Baker with Protect Our Care.
Thank you so much, Lenore, and thank you, Congressman, for everything that you're doing to fight for us in Washington, D.C. My name is Katie Baker. I am the State Director of Protect Our Care Virginia. We're a national advocacy organization whose mission is to strengthen and protect healthcare, and we do so largely through communication-style events like this one, where we're educating the public and engaging with the press to get the word out, as we are today, about the threats to Medicaid. I'm just going to keep it real brief since we have just incredibly distinguished panel here. I'm so grateful for all the elected officials, advocates, and storytellers who joined us here today in talking about these threats. But just a couple things. You know, one of the things, I know most of the folks in this room are probably politically engaged activists. So I just want to give a couple tips for how to talk with your friends and colleagues who may not be following politics quite as closely as you are about how to actually be talking about these threats to Medicaid. So number one, Medicaid is incredibly popular across party lines. People, even Republicans, do not view Medicaid as a wasteful program. So we actually have the winning message on Medicaid. People don't want there to be cuts to Medicaid, and certainly not to fund tax breaks for the ultra-wealthy billionaires like Elon Musk. And it's really important when you're talking about everything that Republicans are doing to our health care, that we, number one, keep it simple. They're taking health care away from people. And number two, that we pair that with they're taking that away from people in order to fund tax breaks for billionaires and the ultra-wealthy. Another point I wanted to make, just if anybody wants to take you into the weeds about arguments on work requirements, we found people actually understand that work requirements cause people to lose their health care. You don't have to explain it's because of the bureaucratic red tape. In fact, the work requirements, as well as the requirement that people are certifying their eligibility for Medicaid twice a year, they're designed to get people to fall through the cracks. That's where we're getting those estimates of hundreds of thousands of people who are going to fall through the cracks. You know, I was just driving up to Massachusetts for my college reunion this weekend. I got a call from my car insurance company. Hey, you didn't renew your car insurance. I was like, oh shoot, I better renew it now because I'm driving out of state. But just think about what the consequences are if you forget to renew your eligibility when it comes to something like your health care. Another point that I wanted to make, that even if you don't get your health care through Medicaid, if you get your health insurance through the Affordable Care Act exchange, Republicans are not renewing the Affordable Care Act enhanced premium tax credits. So a lot of people are going to end up losing their health care over the expiration of those credits because they're not going to be able to afford to renew. I think we've got an estimate of about 5 million nationally. So those are the main things I want to hit on, and the last thing I'll add before passing it to the next person is I think I heard somebody talking about it before we started. How many folks saw Senator Joni Ernst, the clip of her saying everybody's gonna die? Yeah, this weekend. You know, when you think about what you can do, you know, we're lucky here in Northern Virginia to have representatives like Congressman Beyer. But these guys, these Republicans, number one, it's important to call it out because it is Republicans. It's not Congress by itself, it is Republicans in Congress who are leading these cuts. So it's important that we're naming that when we're talking about accountability. And it's also important that we're holding them accountable by making them feel that heat. Obviously, we always want to keep it peaceful, but the moments that they've slipped and said things like that, it's when people have, I think somebody just in the audience yelled out at her, you know, people are going to die. So it's making them feel that pressure, because when they feel that pressure, that's when they show who they really are. And with that, I'll pass it to the next person.
Thank you, Katie, and I'm happy that she said that, because that's the way we've been talking about this in our unit. People are going to die. Next, we will hear from Dr. Heidi Appel.
Hi, thank you all for coming, and thank you to the organizers for inviting me. I am Heidi Appel. I'm a pediatric intensive care physician. I live in Northern Virginia. I really appreciate having a pediatrician here, because children's health is different, and we'll talk about it. But as a physician, I've seen firsthand the difference Medicaid access has made in the lives of my patients. Medicaid helps many of our most vulnerable patients, including children, working mothers, low-income seniors, veterans, and people with disabilities get health care when they otherwise couldn't afford it. Almost half of the children in the U.S. have health care because of Medicaid. And because of that, they're able to get their annual physicals and their vaccines that will prevent diseases with high morbidity and mortality. They are also able to get inhalers and other treatments for their asthma and other chronic illnesses. Plus support and therapy for developmental delays and other conditions. I started my career actually as a general pediatrician on the Eastern Shore of Virginia. Actually, Governor Northam was a neurologist who used to come once a week to our clinic because he grew up on the Eastern Shore. Anyways, I did 2 years of general pediatrics and very rural area. I worked at a community health center connected to the community hospital. So we had a very small pediatric unit. We had one patient who had type 2 diabetes, type 1 diabetes. Her mother also did. They were both insulin dependent. Single mom, she worked at the Kmart. They both got Medicaid. We used to talk to her 4 times a day to get her sugars, to tell her how much insulin to take in order to keep her out of the hospital no more than once a month. So she would come in, even that, once a month in severe DKA. Sometimes we could keep her at our hospital. Sometimes we'd have to send her to the Children's Hospital of King's Daughter. Years later, I've been a pediatric intensivist for about 30 years. I also had a patient with diabetes. He came in, he was a foster care patient. He had been found on the street, unresponsive. He couldn't get his insulin, so he went into DKA. By the time he got to us, he was neurologically devastated. I had to declare him brain dead, and we removed support from him. Medicaid will take away health care to patients like these, and there's so many more. People don't realize that just because you have health care doesn't mean you don't depend on Medicaid, especially for kids. Children with chronic problems, cancer, kids who need transplants, their parents can't. Their health insurance will not cover all that they need, and they depend on Medicaid. So Medicaid will cause lots of issues for physicians like me. We will be spending time trying to get support for our patients rather than actually taking care of our patients. It's beyond frustrating as a physician to see our elected officials make changes that will affect our children, and we should be helping our children thrive. Our children are our number one asset. And with these Medicaid cuts, instead of having them thrive, we're putting up more barriers to them. They're our future. We should be investing in them and not letting them suffer. Thank you.
Thank you so much, Dr. Appel. Wow, that is scary when you think about just the lives that'll be lost for really no reason other than to put money in the pockets of people who are already rich. Like, how rich do you need to be? How much is enough? Next, please welcome Jamie Lockhart, the Executive Director of Planned Parenthood Advocates of Virginia.
Thank you again to the organizers, and thank you all so much for being here. As was said, I'm Jamie Lockhart. I have the honor and privilege of serving as Executive Director of Planned Parenthood Advocates of Virginia. We are the advocacy and political arm of Planned Parenthood here in the Commonwealth. And as Congressman Beyer talked about, just a couple weeks ago, the U.S. House of Representatives passed a budget proposal that would gut Medicaid, but also it would block patients from receiving care at Planned Parenthood health centers. So this is something that I think some folks know about, but hasn't been as widely reported. And that proposal is now before the U.S. Senate. And let me be clear, this is not just an attack on an organization. It's an attack on the more than 1.1 million people who rely on Planned Parenthood for essential care. And it's an attack on nearly 25,000 Virginians who came through Planned Parenthood stores last year. In Virginia, Planned Parenthood health centers provide STI testing and treatment, cancer screenings, birth control, and other vital care. Planned Parenthood health centers treated hundreds of patients for chlamydia, the leading cause of preventable infertility. They identified over 50 potential cases of cervical cancer. This is all just last year. They reached rural communities where there is a lack of providers. And for over half of Planned Parenthood patients nationally, Medicaid is how they pay for that care. If this proposal moves forward, Planned Parenthood patients won't just lose access to care, they'll lose trusted providers in their communities. And many will have nowhere else to go. And let's be honest about what this is. Planned Parenthood is being targeted because they provide abortion care in states where it's still legal. Anti-abortion politicians are willing to sacrifice the affordable health care of people across the country to advance their agenda. They are willing to let cancers go undetected, STIs go untreated, and birth control harder to get. And all of this will actually cost taxpayers, not save them. The Nonpartisan Congressional Budget Office found that defunding Planned Parenthood would increase the federal deficit by nearly $300 million. It is the only health care provision in the budget that would drive up the deficit. And I want to just remind everyone that this fight is about more than numbers. It's about real people. Young people, low-income families, rural communities, and people of color who already face lots of barriers to care. These are the people who will suffer the most if this proposal becomes law. Their health, their dignity, and their futures are on the line. So today, I'm joining our partners here to call on the U.S. Senate to reject this harmful budget proposal. Protect Medicaid, reject the push to defund Planned Parenthood. Stand up for the people who need care the most before it's too late. Thank you.
Thank you, Jamie. Let's pass it to Sarah Florence, a patient advocate with Planned Parenthood.
Hi, so good afternoon. Thank you again for hosting this wonderful roundtable to talk about the importance of Medicaid. I am Sarah Florence. I'm a longtime patient advocate with Planned Parenthood Advocates of Virginia. Usually I have some stories about Planned Parenthood or reproductive health care, but today I'm going to talk about the importance of having access to Medicaid. So I got involved in this advocacy when Virginia was undergoing our Medicaid expansion efforts here. And I've always believed in access to health care, and it is essential for good quality of life And for many, Planned Parenthood offers, good quality healthcare screenings, and personally for years, my OBGYN was my primary care doctor because oftentimes general practitioners would cycle in and out of the facilities that I would go to receive, general care. My own healthcare experience, however, has informed my advocacy and passion for this issue. 10 years ago or so, I was young and I was on the Affordable Care Act, like many, working contract work, gig work, and for many young people that's a norm. We can often have insurmountable debt already with student loans. I would have qualified for Medicaid, but for Virginia not having it, I was obviously unable to enroll in the program. I was good about making my payments to ACA, but then one day I received a cancellation notice that my ACA plan, despite paying into it every month, had been terminated. It turned out that they had not received a check that I sent in the mail, and then all of a sudden I found myself without health care. I was like, okay, well this is fine. I'm relatively young, relatively healthy. There's not much that I can't, do without routine appointments, right? 4 months later, I wound up in the hospital. I had contracted a severe viral infection from which I could have died had I not gone to the hospital. I had a full body rash inside and out. I could not swallow. I could not keep food and liquid down. I could not fit into any of my clothes or shoes because my body was so swollen. My doctors put me in critical care immediately, and it took, several months to fully recover from this. And then I found that upon leaving, I came out with well over 5 figures of debt from my single hospital stay that would have been covered had I just been on Medicaid, and had we had that program in Virginia. And then I also had an issue with recovering because the appointment, for which I eventually was able to find different programs to help cover and fight my hospital bills, those programs wouldn't cover the follow-up appointments with specialists and things that the hospital recommended that I pursue in my recovery. So I wound up for long months unable to take contract work and things like that. And I just want to underscore the importance of what healthcare coverage is for working folks. It is not only the avenue to be healthy, it is also the avenue to provide for your family, to make sure that you can stay in work and keep doing the things that you are doing as an everyday part of your life. And for many people, Planned Parenthood offers those types of services through which Medicaid helps pay for those programs, and screenings and things like that, where you're able to catch vital illnesses. If you get those kinds of preventative treatment, a lot of folks say it's really expensive to be poor or to be broke, and that's very, very true, because you end up shouldering the burden of things that end up urgent issues or emergencies instead of finding out in routine appointments or having to pay interest on bills or winding up with all your medical bills being sent to creditors and having your credit score being impacted for years and years. It's imperative that we not only try to keep this and prevent the Senate from passing this budget legislation, but also make sure that we can expand even on the healthcare coverage that we provide, because it's essential, it's non-negotiable.
Thank you so much, Sarah. I'd like you all to hear from our very own Virginia 512 member, Ms. Renee Bombrey.
Good afternoon, everybody. My name is Joyce Bombrey-Graves, and I am a devoted wife, mother, home care provider, and a proud member of SEIU Virginia 512. I brought my adopted sister Leah and my great niece Lisa to live in my home when my parents passed. I was already working with Leah for years, and I wanted to keep Leah and Lisa in the family. As a care provider, I am compensated through Medicaid funds. I depend on Medicaid funds to help provide for my family to ensure that we have necessities that we need. Decreasing these funds would mean that my clients lose care. I am at risk of losing my home, vehicle and changing my way of life by possibly having to get a second income so I can continue to help my husband provide for our family. It is obvious that bills are going up and prices are going up. So how can we survive if our income is going down? As someone who currently cares for 2 relatives and has previously provided care for many others, I know that Medicaid cuts will make the difference between living a comfortable life or worrying about making ends meet. My clients depend on Medicaid and Medicare subsidies for many important things such as incontinence supplies, nutritional supplies, transportation to necessary medical appointments, including medical testing, doctor's appointments, surgeries, and transplants. Also prescriptions and medical treatments that can save their lives. Without access to these services that Medicaid and Medicare provide, hundreds of thousands of people who live in areas where they do not know how to or do not have someone to help them get the proper treatment, supplies, and health education they need may unfortunately suffer with treatable illnesses, lack of treatment for diabetes, obesity, and many, many other health issues that can lead to an early death. Our country needs for healthcare isn't going to go away because some powerful billionaires want a tax break. The baby boomers are getting older. They will need more care, not less. Virginia will need more home care workers, not less. Our 77 million Americans depend on Medicaid and Medicare for health care, and hundreds of thousands of others depend on it to make enough money to make ends meet. Home care workers have a passion for helping and caring for their clients. Saving Medicaid saves lives. It's definitely a human rights issue. We are asking you to support our home care workers and ensure that they can continue to support their families by allowing their pay to be allocated from Medicaid funds. These home care workers depend on these allocations from Medicaid and Medicare for their livelihood. Thanks very much for having me.
Now we're going to hear from more of our state leaders who are fighting to protect Medicaid. Leader Herring, will you kick us off?
Thank you so much. Good afternoon, everyone. I'm Charniele Herring. I represent the city of Alexandria in Fairfax County as delegate for the 4th District, and in fact, you're sitting in my district right now, so welcome. I also serve as the majority leader. Let me tell you, when I came to the General Assembly in 2009 in a special election, I made it my mission to fight for equity, justice, and access, especially when it comes to health care. In 2019, after years of tireless work alongside so many of you, we achieved a major victory. We expanded Medicaid in the Commonwealth of Virginia to hundreds of thousands of Virginians. I was proud to serve as part of the leadership team that delivered this achievement for our constituents. This expansion was personal to me because it meant that over 630,000 Virginians, our neighbors, our families, and our friends, finally got the health care they need and deserve. It meant that a working mother no longer had to choose between paying for groceries and taking her child to the doctor. It meant that rural hospitals could keep their doors open and that community clinics could offer more than just hope. They could offer real care. But that progress is now under threat. Recent proposals made by the Trump administration and House Republicans will gut Medicaid funding by hundreds of billions of dollars. For Virginia, this isn't just a budget issue. It is a human issue because we have a trigger law. If the federal government cuts its share below 90%, our Medicaid expansion could end altogether. Medicaid also provides critical access to prenatal care, contraception, cancer screenings, maternal health services for thousands of Virginia women. If these cuts go through, it won't just be the numbers on a page. It could mean higher maternal mortality rates, fewer preventative screenings, and less autonomy for women already facing economic hardship. It will disproportionately impact Black and brown women, rural women, and women simply who don't have the luxury of private insurance. Let me be clear. I will not stand by while access to health care is ripped away from the people who need it the most. I've seen the faces of those who have gained coverage, people with disabilities, working adults without employer-based insurance, children whose parents now are able to sleep better at night knowing that there's health coverage. We just heard from Sarah, and Sarah, thank you for sharing your story. There are so many stories, and I just want to put this human factor on this. Right now, just a couple miles away at Alexandria Hospital, there's a family who has a loved one in ICU. There are decisions that have to be made. Now they've got an additional threat coming to them about whether they are going to go for long-term care, whether it'll even be accessible, even whether there will be a home health care worker available. This is real. These are our neighbors. These are our loved ones. And this is again about humanity and basic decency. We, for far too long, have worked hard, and we are not going to turn back. I promise to keep fighting, to stand up to these reckless cuts, and to protect the dignity and health of every Virginian. Thank you so much.
Thank you, Leader Henry. Next, we will hear from Delegate Mark Sickles, who chairs the Health and Human Services Committee in the House of Delegates.
Thank you. Thank you very much. Thank you for inviting me today. It's kind of depressing to think about going backwards on all the progress we've made since the Obama administration. We passed the Affordable Care Act. Congress has passed further enhancements to it, and the General Assembly has tried to do the most we could with the money we have. And we have an historically, because of all that, we have an historically low uninsured rate in Virginia now. And that means that there's less charity care that we've had, that providers get paid, that there's less cost shifting, and commercial insurance for people, for employers that provide insurance to their employees has not been able to go down. If that is reversed, then the whole economy has to pay for what now is being paid for with Medicaid and other government programs. So that's why what they're considering doing in Congress is really anti-business. It's it's not good for the economy. It's not good for people's health. As you've heard, it impacts people getting regular routine health care, which is what we all want. Every person needs a health care home that they go to when they have a problem, and we didn't have that before. So now we have a proposal for a work requirement, which is going to cost the state a lot of money to implement if they do this. And you know, young people sometimes are invincible. They think they're going to not get sick. And you probably heard, especially men, say, I haven't seen a doctor in 25 years. You probably heard that. Well, if they say, well, I'm not going to go to work, they're going to say, okay, I'm not getting that check. And they just won't have routine coverage. And they won't have a healthcare provider in one of our managed care organizations calling you up and say, hey, it's time to get your vaccination, it's time to go see your doctor, it's time to take a colorectal test. All that stuff that will save people's lives is at risk if people don't have a health care home. So, we've made a lot of progress, it's at stake. Right now, I want to reiterate one thing that Katie Baker said. It's not in this bill, but at the end of this year, the premium tax credits disappear. What that means is that the really inexpensive insurance that you can buy on our Virginia Healthcare Exchange, we have our own exchange now, we did that in Richmond, will go up in price. Right now, if you make a little more money because you've got a better job, you don't qualify for Medicaid anymore, and if you work for an employer with less than 50 employees, he doesn't have to, or she doesn't have to provide health care. So we have navigators and all kinds of social service and folks that encourage you to go to the exchange and buy insurance. It's very inexpensive. That's threatened. If those premium tax credits go away, that insurance on the exchange is going to go up. We have 430,000 approximately people now that buy individual insurance on our exchange, and that's one of the reasons our uninsured rate is as low as it is. So this whole package works together to have insurance for everybody. We need to improve what we have now. We're trying to reduce the 15,000 person waiting list for parents with children with disabilities, intellectual and developmental disabilities. I know some of you in this room probably work in that area. We have 15,000 families waiting for that now. we've been trying to build Medicaid, and we don't have the workforce that can do it. Even if we were able to fund 100%, fund the whole 15,000 waiting list, we couldn't get it done without the workforce. I know you're trying to grow that workforce, and I really appreciate the hard work that you do. And as has been mentioned, we're an aging society, and nursing home care, home and community-based services are really important. Our candidate for president on the Democratic side last time campaigned on home and community-based services in the Medicare program, which we don't have now. That was a big campaign promise from the Democratic side, and I think we're going to have that sometime, because in Virginia, you have to be really sick and really poor to qualify for nursing home care. You have to have less than $2,000 net worth to get in and fail for one of the 5 activities of daily living. It is really rough, which brings me to my last point. We need to consider a narrowly tailored assisted living program in Virginia, which we do not have. Medicaid does provide that in other states. If you seek it, we've never had one. There are people that can pass, that won't fail 4 of the 5 activities of daily living, but need congregate care. They need to be in a residential facility, probably because they have some dementia. And they can make their bed, they can eat, or they can go to the bathroom on their own, but they can't live alone. And so we need that. We don't have that in Virginia now, so we need to expand Medicaid in Virginia and not cut it. Thank you very much.
Thank you, Chairman Sickles. Now, last but not least, Senator Ebbin.
Thank you, Lenore, and thank you, SCIU, not just for the work that you do on the front lines of healthcare every day, but for being a modern-day Paul Revere, along with Congressman Beyer and the other panelists, and speaking out. And I'd like to help amplify the alarm we're sounding. It's not the British we're afraid of, but it's Donald Trump with the full-throated encouragement of Glenn Youngkin and Winsome Earl Sears, who are heartlessly endorsing cuts to health care of hundreds of thousands of Virginians. Medicaid is an important partnership between the federal government and the state government, and we have taken actions. My House colleagues have formed an emergency committee to look at the impacts of federal cuts. In the Senate, we have a special committee of our Finance Committee, subcommittee, to review those cuts, and we're in a special session so that we can react. But we don't have the money to just write a check to absolve the federal government of the important responsibility that they have to be partners that's been long established. While Senator Ernst said that we're all going to die, she didn't say those deaths can be prevented and avoided through health care. We have a robust network of free clinics, but it's not robust enough to take up the slack. We have threats to rural hospitals, and rural areas would suffer greatly, along with so many of our healthcare institutions, if this budget proposal became law. There's a choice between tax cuts for Elon Musk and the oligarchy, or healthcare for citizens, many of whom could die without it. So that's my happy conclusion. Sorry to be so pessimistic. But it is avoidable. And it's avoidable if we would all just sound that alarm and reach out to our elected officials. Let's encourage Congressman Beyer's colleagues who are doing the right things, and let Senator Warner and Kane know that we want to continue to speak out. And let's encourage our networks to let those members of the Virginia delegation who did the wrong thing to know that there's a price that will be paid for their actions. Thank you.
Thank you, Senator Ebbin. Thank you, everyone. Education is key. As we continue to fight for Medicaid, it is important for us to understand the range of perspectives and how each of us is standing up to protect our health care here in Virginia. It's critical that we all have access to the care we need when we need it. Let's dig in a little more with our panelists about our ongoing fight to protect Medicaid and what comes next. Congressman Beyer, what have you been hearing from your constituents about these Medicaid cuts?
Fear, anger, and most importantly, stories. Just listening to Dr. Appel and the 2 different, including the young man that you lost. We heard, and what we've been trying to do is take these stories and put them on TikTok and Instagram and Blue Sky and get them out there everywhere we can. I brought a bunch, just one very short one. Annie, 12 years old, was born with bladder development issues. So she's a urinary tract infections, chronic kidney disease. and was doing okay, but her parents didn't make enough money, didn't have enough health insurance, but to rely on Medicaid. So the one time her mom went to the pharmacy and they said, your Medicaid's been cut, and she ended up in the hospital, intensive care. She's still alive, but it's the kind of tragedy that will happen every day, many times a day, if this bill actually goes through.
Absolutely. We have caregivers, as we noted on the panel. Renee, what would Medicaid cuts mean for home care workers in Virginia, the clients you care for, and the broader community that relies on these services?
Well, I do have two relatives. One of them is spinal bifida and one of them has multiple sclerosis. And they will not be able to receive their incontinence, which is, they're both, in wheelchairs and wear incontinence. And one of them lives off of nutritional from Medicare. And as well as that, they'll lose any kind of special doctors they need to go to or anything like that, because it's quite obviously it's unaffordable for someone to just come out of pocket and pay for all the specialists they need to see and everything. So their health will definitely decline, because without the Medicaid, they won't have their wheelchairs fixed when they need them fixed and everything. I'm going through an issue right now where one of the ladies is starting to really show signs of her body changing and stuff. And I took her to the doctor, and they had the nerve to send me a letter saying, ask me why did I take her. I took her because I'm not a doctor, and I saw bones, and different changes. I'm concerned, and stuff like that. So, it'll be to the point where I might have to start reading the medical journal, and stuff. It's just going to take away from their livelihood. And I, unfortunately, will never stop caring for them because they're my family, but then I have a family too, So we really have to fight hard to make sure Medicaid does not go away.
Thank you, Renee. Planned Parenthood resources are critical for the health of our community. Recently, there was a statistic that 25,000 Virginians rely on Planned Parenthood for care just last year. Jamie, I wonder if you could talk more about that and what Medicaid cuts would mean for access to reproductive health care.
Yeah, thank you. So, as was mentioned, 25,000 Virginians visited Planned Parenthood last year. The most common reason people visit Planned Parenthood is for STI testing, but they also visit for birth control, for cancer screenings, primary care, behavioral health care, and more. And so these cuts would make it so that those patients that use Medicaid are not able to use their health care at their trusted sexual and reproductive health care provider. Right now, Planned Parenthood has 6 health centers in Virginia, and with hopefully more in the coming years. And so this would take away the ability of those patients to go to their trusted provider. And one thing that we know is that when people don't go and get that testing, when they don't get the cancer screenings, they aren't unlikely to necessarily get that elsewhere, and that is going to lead to spreading of STI. That's going to lead to cancer, people not getting the diagnoses that they need, and not having access to the birth control they need as well. So it would be catastrophic. One of the things that, and I just want to also mention nationally, so nearly 200 health centers across the country are at risk of closure if Planned Parenthood is defunded this way. More than 1.1 million patients could lose access to care. And then 90% of impacted centers are in states where abortion is still legal. And so this would impact the states most, where care has been, the full range of reproductive health care has been protected, like in Virginia, but also in larger states where Planned Parenthood is such a large healthcare provider, like California as well. And so it would just be catastrophic. And I think we had a similar fight in 2017. I think because this bill is so horrendous, and there's so much chaos from all of these federal cuts, we haven't seen the same discussion about this because everything hitting us at once. But grateful for SEIU and other partners for highlighting these cuts as well.
Thank you, Jamie. Dr. Pell, as a pediatrician, I know you serve a lot of patients across Virginia. Can you help us understand the real-life consequences consequences of Medicaid cuts for those patients and for all of the kids in our state.
So thank you, by the way. What's particularly important to understand in pediatrics is very different than adults. Medicaid funding is the backbone of delivery of healthcare for our pediatric patients. It doesn't matter what healthcare plan you have, Medicaid is what provides the children's hospitals with enough money to support these programs. So children's hospitals are very different from adult hospitals. In adult hospitals, there's public and there's private. Children's hospitals cannot survive without Medicaid. The decisions they'd have to make on budget cuts and programs would be drastic and detrimental across the board, no matter where your status is with insurance or not. And the people who be affected the most are the kids in the rural areas, because we already don't have enough children's specialists there or children's hospitals. A lot of these hospitals have very small pediatric floors or no pediatric floors, and they rely on programs at the children's hospital. That takes transportation, which is also paid for by Medicaid. And if we lose these things, kids with chronic illness, no matter what insurance they have, will suffer. My center is a big transplant center. We do a lot of liver and intestinal transplants. A lot of these kids have chronic problems. Getting a transplant is not a cure. A lot of them require dialysis and also lots of medicines and frequent procedures and trips to the doctor. Without, even the people whose parents have insurance, that can't cover all that stuff. Plus, for pediatrics, there's not as many dialysis clinics, so there's a small number of them. So if we lose Medicaid, we lose those centers as well. Particularly, patients who are particularly going to be hurt are military families. There's a high incidence of military families with kids with chronic illnesses, and they rely on Medicaid because the military insurance doesn't cover it.
Wow, military insurance does not cover it.
Yeah,
That doesn't even,
that's messed up.
like, how do we process
That's messed
that? Thank you, Dr. Bell. Leader Heron,
Yeah.
you are part of the Virginia Democratic House leadership who worked to expand Medicaid in 2018. And now more than 629,000 people have access to health care. Thank you.
Okay.
Can you share your reaction to seeing that years of work Democrats put into expanding health care in Virginia is now under threat?
I'm gonna be honest here. I'm ticked off. I'm angry. I'm just so angry. And you just heard military insurance doesn't cover it. My dad was in the Army. I remember having full health coverage. That's gone for service members, people who put their lives on the line. And I'm gonna just say the hypocrisy of people who have Cadillac-style health insurance offered by the very fact that they're in Congress, if I'm not mistaken. And we are here struggling and fighting for individuals to have incontinence care, to being challenged if you take a loved one to a doctor so they won't get bed sores. I mean, I'm angry. I'm sure that angry, but we've got to continue to work. Like Senator Ebbin said, we cannot let up. This is again about our basic humanity and the humanity of our children. No child should have to suffer, and parents worry if they can provide coverage, especially when they are volunteering to lay their lives on the line for our nation. Or parents who work at our local store, the CVS next door. Everyone deserves access to health care. Everyone. Every family deserves it. We love our children just as much as everyone else. Rich or poor, the love is the same. We've got to continue to work, and let this be the last time that our nation sits and struggles to talk about whether we can afford incontinence care or whether we can afford operations for children. Thank you.
Thank you. Medicaid cuts will have a direct impact on our economy and not in a good way. Unfortunately for us, our governor endorsed these cuts, and his preferred candidate to replace him this November, Lieutenant Governor Winsome Earl Sears, has remained awfully quiet. So where is Winsome? Chairman Sickles, as chair of the Health and Education Committee, you have a deep understanding of the importance of our economy, of making sure people are insured. If people, including many working people who don't have insurance through their jobs, are kicked off their health care, what would that mean for our health care?
Well, that's a $64 million question. I'm sure you, I do not know where Winsome Sears is. And I will not, I probably won't know anytime soon. Well, they're not keeping me informed. So, you know, we will have to, the General Assembly, working with the Senate, the House working with the Senate, we have to take a close look at everything we're doing, both in healthcare and other things. I mean, we spend the most money in this area, but a lot of it comes from the federal government, what we call non-general funds. We spend most of our general funds on K-12 education. We don't want to cut K-12 education to pay for healthcare, but you know what? We might have to do that. That's what's at stake, because we can't let our seniors not have the healthcare they need when they need to go to a nursing home. We cannot keep allowing families with disabled, intellectually disabled, developmentally disabled children not get the care they need. So I think there are tough choices we would have to make. I tell people that most things that the state does, most things that we spend money on, people want more of. They want more public safety, they want more environmental protection, they want higher education that's affordable, they want a K-12 system that works for everybody. And these are the things we do, and people want more of it. So I do not look forward to adding in the healthcare to this long list of conflicts that we have now that we have to sift through to put out the budget we need to have. One thing we will do is make sure we have I think we will go out on a limb here and say we will find the revenue to do what we need to do to backfill when we can. I'm not saying it's a terrible message to say we're going to backfill what the federal government leaves us with, because we can't do that, but we'll backfill to the degree we can do that, so by making a lot of difficult choices.
Thank you so much, Chairman Sickles. Right next to you, Senator Ebbin. So we've seen the big numbers. They sound daunting. They sound scary. We just heard from Chairman Sickles about his thoughts. But what can be done in Virginia to protect our health care if these cuts move through the Senate?
It's hard to contemplate these cuts becoming a reality because we just don't have the money to make up for them in full. As Delegate Sickles said, if we wanted to expand, try and take up some of the slack the federal government would give to us, it would threaten public safety, threaten public education, threaten the other functions of our state government. We won't be able to make up for them in full, and we're here to sound the alarm to say, let's tell the Senate to stop this madness in its tracks. That's what we've got to do. We can do our best to make up for some things, but as Delegate Sickles said, very difficult choices. Who do you save? Who do you give preventive care to? Who do you give incontinence care to? And what about those people on the waiting list? Are you going to allow them to move forward? We can't in a sustainable way, and we're not in a position where we can ask a lot more of our taxpayers in this current climate where Donald Trump is wrecking our economy to pay more. So it's a hard choice, but there will be some difficult choices. I wish we could provide the free clinics with the money they need to take up the slack, but we don't have enough money. We don't have a printing press.
Thank you so much, Senator Ebbin. Last up, we are going to go to Katie Baker. So everyone in this room is clearly concerned about the cuts in Medicaid. How would you advise that we talk to our family, our friends, about what's at stake?
Thanks so much, Lenore, and thanks to all our incredible panelists and elected leaders for being here today. I guess I would just close. I talked a little bit about that in my opening remarks, but just to build a little bit on that. I think it's really important, we're seeing in polling what voters are saying are like the most, or Virginians are saying are the most important issues to them, and it's the cost of living, it's rising costs. And here we have Republicans who are literally trying to raise the cost of healthcare on people. Like, that is insane, and I think it's really important that folks understand that. We don't know what the final bill is going to look like. It still has to go through the Senate. The bill, as it passed the House, would impose for the first time ever copays on people who are on Medicaid in the expansion population for certain special services of $35 per visit. So, I have a friend who is on Medicaid and had a work-related foot injury and is having a number of surgeries on his leg. And he said, if I had to pay $35 every time I saw my specialist, I wouldn't go. And then you have somebody like Congressman Morgan Griffith from Southwest Virginia, who, to paraphrase what he said, was basically everybody needs skin in the game. And so everybody should have to pay a copay when they go to the doctor. Like, that's insane. Like, they're actually trying to impose costs on people. So that's one thing I think is really important for us to be talking about. Another data point I forgot to mention when I was talking about how Republicans are letting those ACA credits expire. Protect Our Care did some analysis for a 60-year-old couple in Virginia. That would mean another $11,000 a year out of pocket that you're paying for your health care. So a lot of folks getting up to that age are starting to be on limited incomes if they are fortunate enough to still be able to work. So I think that's insane, just to think about what $11,000 a year would mean to a 60-year-old couple's budget. And then finally, one other thing I wanted to mention, the Commonwealth Institute, who does a lot of analysis on how these cuts would specifically impact Virginians, issued a report that found 47,000 Virginia veterans rely on Medicaid. Thank you for reminding me of that when you mentioned that military insurance doesn't necessarily cover everything if they have children with disabilities. And so I think that's really important that we're also naming that our veterans are going to be potentially impacted by these cuts. And the final point I would be making, our governor and our lieutenant governor need to be out here at events like this. We have all our local elected officials in Alexandria here who are eager to say yes, to sound the alarm. Like, that's what we should expect from our governor and lieutenant governor too, when we're facing this much of an existential threat to our health care. So we really have to be holding them accountable and asking why aren't they here. And in fact, why did Governor Youngkin even endorse these cuts and holding him accountable for that.
Thank you so much, Katie. So I want to wrap up by thanking everyone, all of our panelists, as well as all of you for taking the time to come out and participate in this critical conversation. You all know I'm an organizer, so we cannot let you go without our call to action, because what's the point of us coming together unless we're going to take an action? So we are fighting every day to protect our basic rights, and it is exhausting. But the more we fight, the more we continue showing up, raising awareness, and fighting back, the better futures we build for our children and our grandchildren. So, the call to action. Everybody take your phone now. I know we have them, unless you're sitting up here and you left it out there. Yes. So, we have a number where when you dial it, it will connect you to a switchboard that will connect you directly to your member of Congress, whether you live in a Republican district or a Democratic district. The number, 866-426-2631. 866-426-2631. Call multiple times. Make our legislators that are up here, no offense, call repeatedly. Let them know how you feel about Medicaid and the importance of Medicaid. Post it on your social media, share it with your neighbors, your friends, your community, your church members, We can save Medicaid, but it is going to take all of us. We also have 2 more of these events. So there's one on Wednesday in Richmond that begins at 10 a.m. at Trinity, is it called Trinity?
10:30 at Diversity Richmond.
Diversity Richmond. And then there is one on Friday in Norfolk. So there are 2 more of these events. If you know folks that are in Richmond or Norfolk, please invite them out. If you're looking for the information, it sounds like Ms. Katie Baker has it. We will also have it on social media as well for that information. And then as we close out, we want to get a photo with folks up here. And then because I see all of my great SEIU folks in the room, when Medicaid is under attack, what do we do?
Stand up, fight back.
We're going to do that again. When Medicaid is under attack, what do we do?
Stand up, fight back.
That's right. So we're going to stand up, we're going to fight back, and we're going to make sure that Medicaid is around for not only this generation, but future generations. Thank you all again for coming.